In today's session, we're going to have an overview of AccessMedicine, including a look at all of the different tabs and the resources that are available in those different tabs, including our books library, some clinical quick reference items, our drug monographs, all of our multimedia content, cases, study tools for board preparation, and more. And we'll also take a look at the My Access profile seen in the upper right in the sign-in feature in AccessMedicine, some of the benefits and features of having a profile. We'll go over that. And at the end of today's session, we will also take a look at some of the support resources that are available to users, including additional helps, tutorials, user guides, and more. AccessMedicine is a comprehensive online resource that provides instant access to information essential for completing evaluation, diagnosis, as well as case management decisions, but also for pursuing research, self-assessment, and board review. AccessMedicine has resources for medical students, residents, and practicing physicians, and it is really great for internal medicine and the medical curricula in that it offers resources for many different medical disciplines. The content is updated regularly, providing the user authoritative, current information. Also, AccessMedicine is guided by an esteemed advisory board. We can view our board members here in the site. It is used in over 65 countries and by 95% of accredited medical schools in the United States. Also, AccessMedicine is mobile optimized for viewing on any device, so you can access it on your iPad, your tablet, or your phone, and it will look just as good as when you access it on the desktop, so no content will smash up and you won't lose access to any of the content. Before we continue looking around at the resources in the site, it's important that we first point out the sign-in feature in the upper right. And when you first get into AccessMedicine, we do encourage you to go ahead and sign into your My Access profile. And if you don't have a My Access profile, it is a very simple, easy process to create one. And again, it is free. After signing in, you will notice your name in the sign-in feature, and beside your name, your institutional affiliation. With a My Access profile, we do encourage you to log in at least once every 90 days from on campus or through a VPN if you're accessing the site remotely, so as to keep your account active and affiliated with your institution. With a My Access profile, you will have numerous benefits that will enable your full functionality for using the site, including being able to select content as favorites to organize in the site. You can also view your history. You can also resume your review questions, any review content and quizzes that you are working on. You can also look at your cases, as well as track on CME and adjust your settings. If we were to edit our profile information, you'll see where you can edit your email address, your first or last name, as well as your password. And out to the left, you'll notice where it says My Alerts. This will allow you to set up weekly, daily, or monthly email alerts letting you know when new content has been published on the site or when any content has been updated. Also, again, with your My Access profile, you can star any content in the site that features a star beside it, and we will look at that more as we explore the site later today, how to add favorites to our My Access profile. But you can star and select multimedia, textbooks, chapters, figures, tables, etc. And then you can organize that content into folders. These folders are really great for instructors who wish to save and organize a batch of content and then export it to an LMS. For instance, I have saved numerous items to a course on pharmaceutics as an example. And if I were an instructor, I could also select the content in this folder to export as an IMSCC file, which can be used in most learning management systems. And this will enable the students to go directly from their LMS course page into the content here in AccessMedicine. Also, users can view their history, so all of the content that they have looked at throughout AccessMedicine, and it is usually listed, as you can see to the right, by date, most recent date. The user also can track on their review questions, so any review content, any quizzing that they are working on in the site. This will allow you to rename quizzes, and those quizzes can either be from board review materials that we'll see later under the Study Tools tab, or also the quizzes associated with our case file series or any of the cases. This will also allow you to rename those quizzes to send to an instructor user. Your results can be emailed. In addition, we can track on our cases, all of our case content, including those which we have opened and would like to resume, as well as those which have been completed. And again, the results of our case quizzes can be emailed to an instructor, for example. And finally, in your My Access profile, you can track your CME or continuing medical education credits. These are designed for physicians to answer clinical questions with current and relevant data to improve patient care. The activities in the CME here in Access Medicine have been planned and implemented in accordance with the accreditation requirements and policies of the Accreditation Council for Continuing Medical Education through the joint providership of the Interstate Postgraduate Medical Association and the McGraw-Hill Companies. The IPMA is accredited by the ACCME to provide these continuing medical education credits for physicians. And we can read more about our CME activities on this page. Each structured internet point of care search is designated for a half AMA PRA Category 1 credit. We also outline our process for participating in CMEs here in the site, how to earn those credits. We outline our whole process. I'm going to navigate back now to the homepage for Access Medicine. On the homepage of Access Medicine, you can flip through this carousel to see all of our textbooks. And we will be looking more at these textbooks under the Books tab in just a moment. As you scroll down in Access Medicine, you also will see news and updates related to the site, including trending daily medical topics through this Access Medicine channel. So for instance, the coronavirus is something that is trending in the news right now, and we can link out to additional authoritative content about the coronavirus here. We also provide an update from the Harrison's channel. And then we also usually cycle through a case of the week, or test question or image of the week. So these three panels do normally change throughout the week. As you scroll down, you'll also see a snapshot of your My Access profile, as well as new content on the site. Here we see this text in pathology, and also we'll notice popular chapters in the site as well, and that's among all users of Access Medicine. Back at the top of Access Medicine, you will notice our search layer. This is just a simple search layer, and as we type, you'll see the auto suggestions that appear. You can run a search in Access Medicine specifically, but out to the left of the search layer, we do provide this drop-down menu that will allow you to run a federated search across all McGraw-Hill Medical sites. So if you subscribe to other Access Medical resources, it's a way of expanding your search to include results outside of Access Medicine in addition to those from Access Medicine. Along the top of our search results, you'll receive the number of results in this search, as well as, again, a link out to those federated search results. So another way of expanding to receive more results. This search builder on the left allows you to modify your search as you go. So you can add in additional terms by keywords, title, or even author or ISBN numbers. You can add those and select Update to parse the results. Also, you can filter results by format presented in this set of search results. So here we see book chapters, tables, cases, textbooks, and more. We also can filter by specific textbooks being produced in this set of results. So we can filter to see what Tintinelli says on the subject, for instance. And then we also can filter by topics. So we see 268 results on therapeutics, 212 results related to vitamins, etc. Out to the right, of each item in our search results, you will notice this star icon, and this is how you can select content to add to your favorites in your My Access profile simply by selecting the star icon. Anywhere you see that means that you can add that item to your My Access profile, which you can then organize into folders. We see our group of folders here, or if we wanted to create a new folder, we could do that. And then to remove it, we simply unselect the star, or we can go into our My Access profile and remove it from there. The first tab in AccessMedicine that we should take a look at is the Books tab. This is where we can find our full text library of over 130 titles that are available in the site. And you'll notice out to the left that they are all organized by these different categories. So if you wanted to just view the text on cardiology or critical care medicine, dermatology, etc., you could parse the library that way and just view those texts by category. Using the Tools drop-down menu, we can view an exportable list of these resources. This is very valuable to librarians. This list can be exported to Excel. All right, and out to the right of each item, you will see the durable URL that is listed. You can either take the durable URL from this page, or if you are on the actual text itself, you can copy it right out of the browser. And as an instructor, if you wanted to copy and embed that durable URL into an LMS course page, you could do so, and it would take students directly into the content here in AccessMedicine. Also, under the Tools drop-down menu, you can view our list of archived textbook resources. So all of the previous editions for any of our currently listed editions in the library, they will come to live here in this portion of the site. And both the new editions and old editions are provided with their own unique durable URLs. Out to the right, you'll see the option to filter textbook resources by those that are CME eligible. And also you can view our textbooks in this graphical grid interface, but you can also switch it to view the textbooks as a listing as well. If we take a look at one of our textbooks, you'll see that we provide a search feature in all of our textbook resources, so you can search your topic once again for results that are just here in this particular text. Also, we can use these tools to expand all chapters or to hide them as well, and we can expand using the plus minus signs listed to the left of each chapter. At the chapter level, we've provided the users with these breadcrumbs built along the top that helps you to orient yourself in the site as you are using our different resources. You'll also see these jumps to the previous and next chapters. You'll also notice the star icon that will allow you to add this particular chapter to your favorites in your My Access profile. Along the top of the chapter, we do provide this chapter taskbar. This will allow you to jump to particular sections within the chapter, as well as to print this chapter. So you can save it as a PDF and then print that as well. And that is only if you use the print feature here on screen in the chapter taskbar. You can share it through email and social media. You also can generate a citation in AMA and MLA citation styles, or you can also download a file to be used with one of these citation management tools that will allow you to convert it to a citation of your need, such as APA. And because this is one of our CME eligible texts, you can also select the ribbon and then add this to one of your clinical queries in your CME folder in your My Access profile. Chapters are organized, as you see, by tabs, including the full chapter, which is all of the text, as well as any images or figures or tables that will also be broken out here. In this case, we see a tab for just the figures as well. And the top of each section does come with an embedded Read Speaker tool icon. And this is our text-to-speech tool to make our sites more accessible to more users.
Patient stories for this third edition of the Color Atlas.
The settings can be adjusted using the gear icon, including text highlighting, highlighting options such as by word and sentence or word level only, also colors for words, sentences, and texts. And if we aren't familiar with what some term is, such as enhanced text visibility, these radio button icons will provide a short snippet describing what this tool does. You'll also see reading speed and scrolling options. And another tool that we have embedded in our AccessMedicine site and all of the textbook resources is our digital annotation tool called Hypothesis. And you will notice as I highlight a sentence, this annotate tool appears, and once selected, will pop out the hypothesis sidebar. Again, hypothesis is seen up here in this sidebar. You'll notice our annotation that we have highlighted is provided above, and then we can enter in our annotation, and we do also have different text options including bold, italics, inserting a link such as to other content in Access Medicine or other Access Medical sites or from the internet in general. You also can insert an image or insert a formula. We can tag the content to make it more searchable and findable. And then we also can set our posting to public so that others with Hypothesis may see our annotations, or we can set it to private. Hypothesis is also really great for group work. So if you wanted to create a private group, such as a topic on infections, a research topic on infections, for instance, or a class topic, you can create a group and share through an email that group, and then you would be able to share one another's annotations. Hypothesis is free as well, but a separate sign up in the site. In addition, all figures, tables that are provided in the chapters can be downloaded. So you can download a complete PowerPoint slide that will come with the citation information as well to help make it easier for embedding in other PowerPoint presentations. You can favorite the figure and add it to your profile, and you can also select this view full size, and this will provide a hyperlink at the top that will take you directly to that figure in context within the text. Back in the library, one textbook that I want to point out is this text resource on understanding healthcare delivery science. In its first edition, this textbook is great in that it touches on policy issues, but expands coverage to practical, structural, and analytic data and research methods that are used to improve the delivery of healthcare. There has always been a big gap between the people who deliver healthcare and those who study ways to improve healthcare, and that is really what this book is all about. It includes some really practical chapters and features that allow readers at all levels to develop a whole new set of tools to improve healthcare delivery, whether they are on the delivery side or on the systems science side. The book is divided into 3 parts. That includes defining healthcare delivery science, also tools to improve healthcare delivery, and how to use analytics in healthcare. The book includes excellent practical features to aid learning and retention, including case examples, key points, cautions, and links to external resources to further reinforce learning. The audience for this new book includes medical education and training, as well as nurse practitioners and PAs, allied health, health administration and leadership, and undergraduate programs in health management, which are spreading rapidly. Next in Access Medicine, we have the Quick References tab, and this part of the site really provides great point-of-care clinical information for our users. It provides a lot of different type of immediate answers, including differential diagnosis, guidelines, and other tools that can be really helpful in the clinical care setting. First up, we do see these 2-Minute Medicine daily literature reports provided by the 2-Minute Medicine Publishing Group, founded out of Harvard Medical School. These provide really concise reports of some of the breaking medical literature and seminal studies in medicine. These can be filtered by the different topics that they represent, so neurology, nephrology, pediatrics, and more. Also, there is now this Search Within feature, and this function allows users to quickly and easily find topics without scrolling through the archives here. And you'll notice that all of these reports are listed by date, by most recent, with a link out to that report. So here we see the report and then a link back to the original article, which would be respective of paywall boundaries. Also under quick reference, you will notice our differential diagnosis tool. This is called Diagnosaurus. And we do provide differential diagnosis information for thousands of symptoms, signs, and diseases. You'll see that they are organized by symptom, disease, or even by organ system out here to the left. And across in the middle, you'll see where you can search Diagnosaurus or browse alphabetically. These items do provide links out to other entries, related entries in the site, which really helps to form that differential diagnosis. So here under this See Related icon. And again, these links do go out to different portions of the AccessMedicine site. Also, under quick reference, you will see these diagnostic tests. And this is a really great reference manual for medical, nursing, and other health professions. It is really a great quick reference guide to some of the commonly used diagnostic tests, including lab tests, lab procedures, diagnostic imaging tests, also electrocardiography. And included in here are over 350 of some of the most commonly used diagnostic tests, and these do include also full citations with links out to literature from PubMed. Also under quick reference, we now include Goodman and Gilman's FDA approvals. This resource represents an exciting new presentation of the Goodman and Gilman's text. As part of this new presentation, the content in this feature will be updated annually, and it provides a more robust chapter version of the content. It represents a more succinct and easy to navigate interpretation for end users to more easily learn some of the recent additions and changes to drugs. On the page, you can filter by first-in-class agents out to the left, also by first-in-class biologics, pharmacological similar biologics, and pharmacological similars. And if you desire a deeper dive, these links will take you to the summary pages, and these summary pages also include links back to Goodman and Gilman's, seen here. Also under quick reference, we do provide guidelines for inpatient medicine and primary care. This allows users to brush up on some of the latest disease screenings, as well as prevention and management regimens for different topics in inpatient medicine and primary care. And finally, under quick reference, we also provide this quick medical diagnosis and treatment text. You'll see along the top where this text is searchable, and it really is a great text. It's one of the leading texts for medicine in many hospitals and outpatient settings. You'll see it's also organized alphabetically. The text is really great for providing some concise, evidence-based point of care information. It outlines diagnosis and treatment information for very common conditions and disorders in a quick reference format, usually in a bulleted format. So key features, clinical findings, and you'll notice it's broken out in this bulleted format for quick ease of access to information. And it does provide some of the key diagnostic and treatment features for more than 930 disorders. Also at AccessMedicine, we provide our drug monographs. It's our integrated drug database. It's a really great authoritative source for thousands of drugs and drug information. You'll see that they are organized out to the left by generics, trade names, and drug classes. Again, it is searchable and organized alphabetically across the top. And as we search, you'll see again our auto-suggest that appears. drug monographs are updated every 2 weeks. So in the monographs, you will typically see some basic information, including images, but also brand naming, including in the United States and internationally. So here we see some international brand names for gabapentin, also some medication safety related issues. You can also access clinical pharmacology data, as well as information about indications and usage, contraindications, warnings, and precautions. We also provide administration and dosing information by population types. Here you'll see adult and geriatric, pediatric populations. We also provide some pricing information as well as some general patient education information as well. And out to the left, you'll also notice our patient handouts in the drug monographs. These are available in English and in Spanish. These handouts are written in very clear terms to ensure that your patient will be aware of how to properly take their medications, as well as any side effects that they may encounter. So here you will notice some common questions that a patient may ask of his or her physician. Next up in AccessMedicine, we have our Multimedia tab. And the Multimedia collection in AccessMedicine offers a robust library of procedural and conceptual videos, diagnostic and imaging studies, lectures, learning modules, a podcast, and more, including this auscultation classroom. And this is a new multimedia resource that provides students with the ability to hear an abnormal heart sound while simultaneously watching a graphic of the intracardiac abnormality that is occurring. And with this, it helps the students to learn the proper auscultation techniques for each murmur. These modules also discuss some of the basics regarding clinical findings associated with the murmurs. And this method of learning really is designed to help students grasp this difficult concept and solidify their understanding. You'll see where the module is navigable over on the left. I hope you could hear the murmur there, and if you couldn't, I really encourage you to go back and explore this resource on your own in AccessMedicine. The auscultation classroom launched with an initial 6 modules, and additional modules will be launching early in the first quarter of 2020. And the target audience here really includes medical students, NP students, as well as PA students. And you'll see where each of these modules offers an introductory slide and then auscultation point slide. And also a final slide, in this case aortic regurgitation. Alright, also under multimedia, I mentioned earlier some of our videos. You'll see our procedural and conceptual videos that are provided, and this does provide over 860 videos and animations. And it really is one of the most complete collections of detailed procedural videos online that are designed to help users through some of the basic and advanced skills procedures, brief interventions, and applications of decision rules as well. You'll see these videos broken out over on the left by different categories. So we see, for instance, our 2 videos on dermatology, but you can also see our other videos such as neurology and pulmonary. Also under multimedia, we do include these diagnostic and imaging studies, and this includes over 30,000 world-class images that are useful for diagnosis. And they also can be shared through email and social media. In addition, under multimedia, we include these Harrison's pathophysiology animations, which are new. Each of these episodes covers a disease mechanism, and the running time of them is each a student-friendly 4 to 8 minutes. Nationally regarded educator Scott Stern from the University of Chicago wrote and narrated each of these episodes, giving our series some authenticity that is often lacking in medical animations. And we will post additional episodes every month for the next several months with a goal to have 150 of these animations available. Next, under Multimedia, you will notice Harrison's Podcast. This is our podcast series that includes some illuminating and engaging discussions on some of the key principles of internal medicine around board-style case vignettes, all from the acclaimed Harrison self-assessment and board review text. Again, AccessMedicine is mobile optimized, so you can open it in a browser on your mobile device and listen on the go. And currently we include over 100 new audio podcasts here. Also under Multimedia, you will see our new Human Anatomy modules. These Human Anatomy modules are broken out into the complete Human Anatomy modules, seen here by female and male complete anatomies, but also by our Human Anatomy tours, which we'll take a look at in just a moment. When selecting one of the anatomies to open, please keep in mind that it may take just a few moments to fully load the module. These are really great interactive modules that allow for visualization of the human body in an interactive 3D format. Along the bottom of the module, users will see some of the output options that are available, including more tools, including how to select, hide, fade. In addition, we provide a search anatomy tool, which prompts over on the left our anatomy tree, as well as the search tool. So this will allow users to search for specific anatomical structures in the model by name, or browse through all of the structures contained here in the anatomy tree. And once you select one of the structures, it will zoom in on that structure in the model. These anatomy descriptions will also provide users with the option for reading more about specific anatomical structures as they explore. And when available, individual structures will be linked to Wikipedia descriptions, which are generally sourced from Gray's Anatomy. Along the bottom, also users will have different 3D controls, including to pan, so to rotate the image, to zoom in and out, as well as to recenter the 3D module. Here, if we use our pan tool, we can move the image around. Also under the Human Anatomy modules, we include our Human Anatomy tours. These focused 3D modules guide medical students through some systems-based tours of the human anatomy, helping them to learn human anatomy in a systems-based interactive format. These tours also will take a little bit of time to load, as with our anatomy modules earlier. We launched with 7 modules or tours, and additional tours will continue to be added to the collection throughout the year. A number of enhancements have been made to these existing modules to make them more dynamic. For example, this endocrine tour now demonstrates thyroid hormone disease. And each module features roughly 7 to 10 slides, navigable over on the left. Another tool to point out under Multimedia include our patient safety modules. These online modules will provide you with an introduction to some of the core concepts of patient safety in an interactive and self-paced learning environment. It includes some of the professional issues such as hand washing, understanding error, and communications concepts. You'll see that it is navigable over on the left. Each module can be used as a standalone tool or as part of a broader curriculum in patient safety. Also, under the Multimedia tab, you'll see that we include tutorials over the patient interview. So this is multiple videos that teach users how to interact with patients, such as follow-up with an inpatient interview, how to interrupt, patients with mental health disorders, So some very interesting videos here, and they're all also a student-friendly time length as well. The next tab that we see in Access Medicine is the Cases tab. And the cases in Access Medicine provide material for short, targeted, case-based learning that really requires students to think critically about the content. And we have all of our cases in the site organized by different areas. So you'll see our acid-based disturbance cases, our case files series from our case files text resources. You'll also see our cases organized by other different text resources, so clinical neuroanatomy based off of that text, our family medicine board review cases, fluid electrolyte and acid-based cases, etc. And all of the cases will vary slightly, but for each case you'll get generally a patient history, an overview, a summary, a systems review, some short answer questions, and also comprehension quiz that the results of which can be emailed to an instructor. Many of these also provide references. If we select our acid-based disturbance cases, you'll see out to the right a key. This will indicate to the user any unopened cases or cases that have been viewed or completed. So here in our acid-based disturbance cases, you'll see where we are provided with a short presentation of the case. And then we also can move on to our series of questions. Please notice your different tools that are available to you, including favoriting and adding the table, or also adding the case to your favorites as well. You can download or print, and you'll notice that as you submit, you can also view your answer. So this short answer explanation really helps to reinforce learning as you go. And you'll notice that as we work through our case quiz, that as we select our answers toward the end, you'll see the option to email the results. So here we have our explanation for the incorrect answer. And then just as an example, I want to show you how you can email the results. So if we submit and complete the test, all right, we see all of our results with our answer explanations, and toward the bottom, we'll see our different output functions, including this option to email these quiz results. So I could email them if I were a student. I could email these results to an instructor. And I do want to point out that all of our cases here in Access Medicine are embedded with durable URLs, as with our multimedia and our text resources. So as an instructor, all you have to do is select a case and copy the URL in the browser up at the top in your browser, and you can embed that link in an LMS, and it would take students directly to the case in Access Medicine, and they can work through that case, complete the quiz, and email you the results, and you can collect that for a grade as well. If we take a look at our case file series in Access Medicine, we break these out here in the basic science cases. So in Access Medicine, we do provide a few of our basic science cases out of the entire case files collection, which is a separate site. And you'll see these organized into these different areas, so anatomy, pathology, physiology, microbiology, biochemistry. And the case file series really provides some great in-depth case-based learning as well. You'll notice our key out to the right again. The default view for our cases is by case topic, so you're able to view the topic of the case beforehand, statin medication, sickle cell disease. However, out to the right, you also can use this case number, and this is a really great way to challenge yourself without knowing the topic of the case beforehand. And you'll notice this case looks a little bit different in terms of what material is provided in these tabs. Here we have our case presentation, our overview, our introduction to the case. And as we go along and answer these questions, this Save Answers tool is enabled to us. So again, if you are signed into your My Access profile, you can always come back and resume work on this case. We are also provided with Approach, That includes some of your clinical information, so we'll see our objectives, some definitions, discussion, any relevant figures. And you'll notice different blue hyperlinks sprinkled throughout the site that will take you back to our drug monographs as well. So wherever relevant, we do include links back to the drug monographs. You'll also see these pearls, these clinical pearls, the key points to remember concerning the case, as well as our references. And again, our cases are peer-reviewed. And then also a series of comprehension questions. And just like we saw earlier, these all can be submitted for a grade. You can email the results of these as from a student to an instructor, and they can be collected for a grade. And you can submit and view the answer as you go along, or submit and view the next question and see a accumulation of your answers at the end with your results page. You can continue working through the cases in our case tab. Again, we do have them broken out into these different areas. So for instance, our internal medicine cases, these are based off of a resident readiness text. You'll also see our clinical neuroanatomy cases based off of this text from Stephen Waxman, now in its 28th edition. So some different options here for case-based learning. And these cases really are great to integrate into a course where you don't have to write your own cases as well. So it will save you some time as an instructor. I do want to point out also these Vanderbilt Internal Medicine Pediatrics curriculum cases. This is a comprehensive case-based curriculum for the care of adults and children in the outpatient setting. This curriculum can be used by learners in all stages of training, from students to residents to practicing clinicians. It is updated regularly to reflect some of the newest research and guidelines. We have provided here a suggested schedule for residency, but feel free to sort by topic or organ system as well. For instance, if we select food allergies, you'll see our case that you can work through. So we'll also be provided with learning objectives and then the different cases. And you'll see some similar functions, including saving answers and showing answers as you work. You'll see our comprehension questions. Again, you will be prompted to sign into your My Access profile to complete any of our case comprehension questions. And again, our reference information with links out to the PubMed literature. Access Medicine also provides a lot of board review and exam preparation tools seen here in our Study Tools tab. First, we see this Clerkship Topics. And under Clerkship Topics, we provide a curated collection of the study materials seen throughout the site, and they're brought all together in one place. So all of our resources that are specific to clerks, our editors have brought and gathered into at least one spot here in the site rather than having the user go throughout the site looking for relevant material. The Clerkship Topics here provides resources for most every major topic that we saw in the listing, so cardiology, pulmonology, many of the different aspects seen in internal medical clerkships. And so we do provide some of these select chapters and cases from across the Access Medicine site. You'll notice different text references, case files, videos, and it will look different for each that you select, but those are all brought into one spot here in the site for clerks. Also in our study tools, we provide some gamification, including flashcards. These flashcards are a select set of some interactive flashcard content. These flashcards allow you to drill down by resource and or topic to focus in on areas of weakness. These also are responsive on any mobile device. And in the flashcards, you can use the carousel to navigate to flashcards to specific resources. So we see our current medical diagnosis and treatment text flashcards. That's a great resource. You'll also see pathophysiology of disease, medical physiology, pathology, diagnostic examination, pharmacology, and also biochemistry and genetics, microbiology and infectious diseases. So you can select the different flashcards, which can be flipped to reveal some of the key concepts and other relevant important information. These are really a great tool for studying. I'm going to navigate back now to our Study Tools page. Alright, also under the Study Tools tab, some other gamification that we includes this Play Showdown. This is a great tool for working with groups as well. It's a great way to challenge your colleagues on their medical knowledge, quiz bowl style. So this is where you and your opponent will battle through 2 rounds of questions, each with 5 categories. So it's a turn-based game. You can play live with others, or you can play with the computer as well. It will allow you to choose your difficulty level, and then you can select your topic, which will vary by the difficulty level selected, and you can take a timed or an untimed. And then you can select questions based off of these different point categories and the different categories listed across the top. And if you aren't sure of the answer, you can select Give Up, or as you type your answer, you can also submit and reveal the correct answer with a complete short answer explanation. To our Study Tools page here in Access Medicine. Also, you'll notice our review questions, all of the different text resources that we have available. These are organized into basic sciences and clinical practice and board review text resources. And they are further categorized as well. So for instance, we could select some microbiology review texts, and this will allow the user to generate random or custom quizzes based off of these texts. So we'll see a link back to the book, and here we can generate a random quiz of up to 1,100 questions available. You also, as a user, can select from these different categories and create your own custom quiz, and the results of these can be emailed to an instructor as well. All of our review text resources also are durable URL enabled, so if as an instructor you wanted to copy the browser URL and link to this review text from an LMS, you could do that, and you could actually assign from the custom quiz feature, if you wanted to assign, for instance, all 51 of 51 questions available on mycology. If you wanted to assign all 106 questions on parasitology, you could do that, and that would ensure that all of your students are completing the same questions on that topic, and then you could take that for a grade as well. They could email you the results of their quiz. So I do encourage you to look at some more of our review resources for the clinical, but also basic sciences. The next tab you'll see is our Patient Education tab. We have broken our patient education handouts into our different advisors, so adult, medicines, pediatrics, and these are available in several different languages and are organized alphabetically across the top. The PDF is available out to the right. However, if you select one of these handouts and are signed into your My Access profile, here along the top you'll notice the different output options, so printing, downloading the PDF, and emailing. But if you're signed into your My Access profile, you can select Customize, and then you can customize this patient education handout and provide it as a PDF. So if you wanted to add in any kind of logo or office information or any specific instructions for a patient, any kind of personalized message for a patient, you can do that here and open a customized PDF, and that would be a great customized handout for your patients. So that's a really great tool that is offered here in Access Medicine as well. And the final tab is the Hospital Corner tab. And this is similar to our Clerkship tab in that it is all select content from across the site, so brought together by our editorial board. It's all been curated, and it's really geared toward practicing providers. So we're trying to provide that content all in one place in the site rather than having providers and users look throughout the entire site for the content. We've brought it into one place. It includes selected textbook resources, also select board review content, so some really specific preparation for that. Also our quick reference materials, cases, specific video and multimedia content. All of it really designed to help the practicing provider to hone their skills. As we mentioned at the beginning of today's session, I want to end by taking a look at our user support resources. So this is found under the Support tab in black along the top, and you can select User Resources, and this will take you to our separate website. This is called the Access User Center. It's navigable in this menu out to the left. And we organize our resources by the different medical products. So included here is AccessMedicine specific resources. You'll see here our suite of videos, so lots of different training videos and tutorials showing you the different aspects of the site. You'll also see more information about our patient education handouts, how CME credits can be learned, how to create a My Access profile. You'll see some of our marketing material as well, so banner images, different flyers and brochures. You'll see more information about our human anatomy modules, how you can download images, how you can search, and more. So I really do encourage you to take a look here in the Access User Center. We also provide more information about our training webinars, so if you wanted to sign up for any of our upcoming webinars, or you can click at the link and view our archive of webinars to view a recorded session. We also provide more information about pulling usage statistics. This is very helpful for any account administrators that are on the call today. We also provide these content maps. So this is where we are linking to all of the different resources that we have. We map our resources to different educational and accreditation standards, programmatic standards. So you'll see some of the different programs listed here. And we are continually adding to these. We also provide information about how you can download your MARC records and KBART title lists. We also provide search widgets which can be embedded, and then also a contact us page. This is a really great way to reach out to the user services team. So if you have any questions about today's session, or for any other questions or concerns or suggestions, issues that you're having, please reach out to the user services team. I'm highlighting our contact information on screen, and that is userservices@mheducation.com. Please feel free to reach out to us with any questions. We do strive for a 24-hour turnaround time as well. And that will conclude today's session with a look at AccessMedicine. If there are any remaining questions in the chat feature, we will work to get to those before we become disconnected. Also, after you disconnect from today's session, if you will, please take the time to fill out the survey that will prompt in your browser, and we would really greatly welcome your feedback for today's session. We'd like to thank you again for joining today. Have a great day.